it seems that the kids really, want the information, and then they go and they read it on their own and stuff like that. So, it was actually a good turnout. We had a lot of middle schoolers coming, rushing the table, so we did have to do some crowd control, just because it was candy.
Yeah. So it was definitely like sixth graders.
Yeah.
It was just, we were like, they literally like moved the table for us. They pushed us back into the lunch line.
So
Crazy up in there.
Yeah, I did have like little fidgets for kids, just talking about how it can manage stress, and how, these are the small things that people can do when they are stressed. As people sometimes will click a pen, things like that, and having them kind of really being mindful of like, if I am stressed out, maybe I should have something in my hand and fidget with it. So we had some good discussions with them about that. So.
Yeah, and we were there for all 3 lunches, 6th, 7th, and 8th grade, and we were just completely cleared out of all of our materials. So that was great. We're looking at other opportunities for each month to be able to go back in and focus on a different topic at each table. After that, we had the Fatal Vision workshop at Madison High School, thanks to Diana Russo organizing that. So we did that in December. We had a table during the support period, so it's called, right? Towards the end of the day, we had different Fatal Vision goggles. We had lower VAC levels ranging all the way up to high. We had marijuana simulation goggles as well, and we basically were asking kids to stop by the table and try and do different simple tasks with the goggles on, and then have a conversation with them about what they were feeling and how that would translate to being on a road, driving, and sort of how what that impairment would feel like in those scenarios. So it was great. I'd say we probably had 20, 25 kids stop by that table. So that was great. We also were there at Madison High School yesterday, as Gabe mentioned. That table, we focused on the sour candy initiative, which we had talked about. I think we talked about it at our November meeting. We have examples of the candy and the card that goes with it, and then the supplemental information at the table up there. But again, we had kids stopping by. That one yesterday was during their lunch period, which was earlier in the day. So Gabe and Christine really kind of walked around and got people to stop at the table, going to different lunch tables and encouraging them to stop. So again, it was great. We did notice yesterday as well that they were taking some anxiety and depression pamphlets. So it's definitely, that's why they're there, but it is interesting to see them actually taking the materials as well. So showing that need. We had a couple of weeks ago, or last week, I guess, was Law Enforcement Appreciation Day. So I'll take this opportunity now that we have law enforcement in the room with us to say thank you for all of your support. We were able, Christine and I went around to Florham Park, Madison, Chatham Borough, and Chatham Township police stations just to drop off a little basket and to say thank you. So that was a great opportunity to meet some people doing that aren't coalition members. So that was last week. Along with that, we had Hidden in Plain Sight last week at Chatham Middle School. So we ended up having, I think it was 49 people showed up, which was a fantastic turnout. We worked with Tim McMahon from the DEA. Again, this is the 5th year that we've worked with Tim on Hidden in Plain Sight. The first year that we did it, we had it here in the teen center, and then we've gone back and forth, Madison, Chatham each year, and then the COVID year we were virtual. I think this was the highest turnout that we had, and it's always interesting, it's open to Madison and Chatham families, but we always get we get people that live in the town where the event actually is hosted. That's always how it is, unfortunately, but not unfortunately. It was great. I think there were some Madison parents there. But what was really interesting was the conversation, right? Parents, Penny and I were saying last year, there were so few questions when we had it at Madison High School. It's not that parents didn't seem engaged, just they didn't have questions and they weren't looking to share. But what ended up happening last week was it almost turned into like a conversation, right? People were kind of bouncing questions off of one another in the audience.
We had the Chatham police were there and the Madison police.
Yes.
So-
Right, and we were battling each other.
Yeah.
We were bouncing off each other too.
So the questions were really thoughtful and they were interesting. And I always find it very interesting to hear, like, kind of, it gives us kind of insight into what parents are dealing with and what they're, I'll give the example of the first year that we did this in the teen center. That was the year of the CBD versus THC questions, right? I mean, those were, parents just were so confused, and I think a lot of people still are, but so confused about what the differences between CBD and THC are, and will CBD show up on a drug test, and will THC show up on a drug test? And it was just very much, that was the focus for sure. I think last week, a lot of the focus was on what should I be looking for, right? Would you agree with that?
Yeah.
Like, what are the physical signs and symptoms that I should be looking for of substance use in my teens? Tim focuses a lot on fentanyl because he works with the DEA, and that's what they're so focused on right now. So I think there were a lot of questions about that as well.
And you saw like the wide variety of like how parents deal with things, how they're dealing with them now versus, what should they be doing? Some parents were almost, I don't want to say clueless, but really don't have a handle on it and need to know, ask the question. Then there was a father in there who's like, I got cameras everywhere and everything. Like, yeah, so do I. So, there's two extremes. But it just goes to show you that that's what the community is made up of. So
yeah, and also like very technical questions like, what do I do if my child, if there's kids gathered in my basement and there might be drinking happening? Like, what is my role? And it was very interesting. Like, Tim definitely kind of gave the response of, they're your kid, like you have to set the rules. You have to be the one to
go down to the basement and
go down.
Because they were worried about liability.
Yeah. It's always, like I said, it's always good to get insight into what parents are thinking and what their focus is. And we actually had a good long discussion with one parent in particular who kind of the takeaway from that is that she feels like she's alone, not alone, but she's in the minority in terms of she doesn't want her kids to do this, but she also feels the pressure from other parents of, I don't want to be the only person that is not allowing my child to go to a party or do whatever. And so, like the conversation that we had, and we were all involved in this conversation, was that I think the perception is that there's less parents that feel that way than actually do. I feel like I've had so many conversations with parents that are in that same boat, that feel like they don't want to, they agree it's illegal and it's dangerous and X, Y, and Z, but the voices of the parents that allow it just seem to be much louder. And so one of the takeaways from that is, how do we gather these parents that all feel this same way? How can we provide support to them so that then they can have a concrete set of, steps that they can take with their own kids, and how can they feel supported in that? So yeah, it was great. We also, thanks to Epiphany, we were able to get a survey together fairly quickly. We try and always administer surveys, parent surveys, when we have parents gathered like that. Knowing that we would have that many parents in one place, we knew that we wanted to ask some questions. We're kind of due to collect some new data regarding parent perception of youth substance use in Madison and Chatham. So we got at least 35, 40 surveys, which is going to be great. We'll be able to, Gabe and I will work with Kelly on inputting that. And kind of coincides with our next round of data collection anyway. So we'll be able to take all of that data and update our logic models, which will be really good for us. So definitely be doing this event again next year. It always is so great, and Tim's great to work with and so knowledgeable. So thank you, law enforcement that was there. We did have, like Christine said, Chatham Borough had, the chief was there, plus a couple, a lieutenant detective as well. So, and then Madison and Chatham Township also. So thank you guys for being there and for answering the questions. Everyone was very forthcoming with their information, which was great. And then the last thing we also had last month was our Teen Topics binge drinking workshop. So we did that here in Hubbard. We had, how many kids did we have for that? 7? Yeah, something like that. Maybe not that many, maybe 8. So that is similar to our vaping workshop that we put together. This one focused on binge drinking. We show a clip of a documentary, and then we have a presentation that goes along with that. So Christine and I talked about, it's a good presentation to offer to seniors this summer before they go to school, just because there is a lot of kind of new information, I guess, that maybe supplements what they're learning in health class, but just it would be timely to do it right before they go to school.
Yeah, we should see about the high school to the PE teachers to see if they're interested in us bringing that in, the seniors. I think one of the surprising things was a lot of the kids were like, really? You can die from too much alcohol? Like they just thought you could throw up and you're fine. But there's not really a risk of death. So that was very interesting that these kids really do not have the education. We think that they know it all, but they really don't. So I think it's important that and some of these kids were students and seniors.
Yeah.
So that's pretty scary when you go in college. So this was great that they were there and like tell all your friends, be careful, and also that it's obviously supposed to be 21, but even so in college there's a lot of alcohol. It's like a huge thing, which we all know. So yeah.
Okay, so upcoming events that we have Teen Topics on Thursday of this week, I guess, right?
Yes.
Yeah. So this one is focused on, you want to talk about this one? Sure.
This one is going to be focused on ocean conservation and what do your part, so what kids can do themselves for helping with the sea animals and with the oceans and the beaches, what kids could be doing. It's all part of like self-care, like taking care of your environment, taking care of yourself. So it should be a really good, a good kind of meeting. And person doing the speaking does scuba diving for young people, and they do excursions to out of the country and stuff as well as here in the country. So it's going to be very interesting to get some information. And then we have another one coming up on the 15th. From our very own nutritionist from the Y. She's one of the swim coaches, and she also works for, can I say this? She works as a dietitian for the Jets. So she's going to be coming and doing a whole talk. I just was going to throw that in, just the
Yeah, and then our March
21st one
is rescheduled from the late fall, and that's supporting your LGBTQ plus peers. So that is geared towards, we're marketing that towards the GSA clubs at both high schools. And for anybody that wants to learn more and support their peers. So we're working with Nicholas Lepper from Edge for that one. But in particular, the January one, we have not really done, most Teen Topics that we've done have really focused on, like healthy mind, healthy body, sort of. We've kind of gone back and forth with substance use and then mental health, mindfulness. We wanted to add a component that focuses on like service and volunteerism and learning about other issues as well. This one we were able to push directly to our mariners. And then also,
oh yeah,
you want to mention?
Yeah, we had the biology teachers in the middle schools are going to be offering, they get like a credit for homework or something if they come to the workshop. So we just have to give them like a little certificate that they came. So schools are very interested in us doing this, so it's great.
And that's been a challenge, I think, for us, like, trying to get an incentive from the schools, which we understand why, but, trying to offer extra credit or incentives is very difficult. So we were very pleased that they were willing to offer that for this one. So that is on January 25th on Thursday. And then next week, Christine is going to be running or sponsoring an event at NJS, right?
Yes.
Do you want to talk about that?
Yeah, that's going to be on Wednesday, the 31st at 7 o'clock at Madison Junior School in the auditorium. And we're going to have a guest speaker from Wellbeing. Her name is Lauren Murello. And she goes around and she talks to parents about the safety for kids with social media and screening, using screens. So it's going to be a really good event. So we're really excited. The principal, Mr. Perel, is helping us kind of spread out kind of information about getting a lot of junior school parents to come. So please come out if you can.
Do you know if she does presentations with the youth as well, or is it just strictly the parents?
I believe it's just parents, although the Wellbeing does run groups and stuff in their programs for kids.
Yeah, they have therapy groups.
Yeah, they have therapy groups.
Yeah, but that's not what I mean.
No, but she does, yeah. She like has a thing. She like goes out and good questions. She speaks to parents about.
Okay. So nobody, do you think anybody there would be?
It might be, yeah. I mean, I could give you her.
Yeah, well, I mean, it's on the flyer, right?
Yeah, yeah.
Awesome. And then February 9th, we just locked in this date, will be our next basketball at the Y event. So this will be our 4th basketball at the Y. So you remember the last one we had was in December. And again, shout out to law enforcement. We had representation from Chatham Borough and Madison Police for that event. So we're looking forward to that. Again, hopefully we can have Madison, Chatham Borough, Chatham Township attendance there as well. Excuse me. So it's 6 to 7 o'clock. That's a Friday evening, which is purposeful that we are doing that on Friday evenings here in the gym, the basketball gym here. A hard time with Gators and practices and everything. So we were very grateful to get that time slot in February. So we will start pushing that out. I think Christine and I spoke to marketing yesterday. I think we're going to do a press release to promote that event. And we're actually going to use the photo that we took at the last one. So law enforcement is in that photo. With some kids that attended as well. So we're going to try and push that out a little bit differently this time to ensure that we get as many kids as possible. We also always push to 7th grade initiative, all program areas here at the Y, and then it's also in a media blast that goes out to members as well. So that's coming up on February 9th. Those are the upcoming events that we have planned right now. So
I think that's a lot.
well, yeah, no, it's a good amount, but that's kind of what we have going on right now. Sue Heffernan is not here, but I do want to give her a shout out. So we had spoken at the December meeting about the Harding Public Library. So Harding is one of those towns that's in our catchment. I mean, they're in our area, but we don't typically do a ton with Harding, but we should because those kids potentially go to Madison High School. So Sue volunteers at the Harding Public Library, I think one day a week, and we talked about the partnership the coalition has had with the Chatham Library and Madison in the past as well. And she had suggested trying to establish a relationship with Harding Public Library as well. And since that December meeting, she's done that. So we are officially, our materials are on display at the Harding Public Library. We have a rack card holder similar to that one that's up there. And then we also have a supplement, like another one that has just information about our programs. So that one focuses more on different substances and ways to talk to your kids about substance use, things like that. And then the other one has information about the Teen Task Force, PCP, MCC, and then our resource cards as well. So we were specifically wanted it only to be our materials that we've created in this rack card. And then Gabe, Christine, and I are going to be going to the library to meet the librarian and to talk more about what potential there is for other opportunities, I guess, ways that we can work together in the future. So that was a great connection that Sue made for us, and kind of getting us into another area so that when kids are getting to high school in Madison, they're already familiar with both of our programs and the services that we can provide. So Thanks, Sue. So also Teen Mental Health First Aid, I'll give you another update there. The Y has identified another person to be trained as an instructor. So that training was supposed to happen last week. Unfortunately, it is going to be, I think the training that she's going to be doing is in 2 weeks. So we'll have another instructor here on site. I don't know if I gave this update at the last meeting, but we are going to be starting our first training group is going to be the Rosettes. 10th, 11th, and 12th grade gymnastics team members. So looking forward to that. And as soon as Jessica is trained, we'll be able to finalize more details. And then last thing is night of conversation. So we had talked about this at our November meeting as well. We are going to be showing the movie Screenagers Under the Influence. Initially, we had talked about doing that, showing that screening at the Chatham Cinema in Hickory Tree, but we've decided against that and having some conversations with some people here. We thought if we can find the space here on an evening, it would be better if we can to offer the movie here for parents, but invite parents and teens to attend together, separate them, and then Christine and I and Gabe would do a workshop with the kids, and then the parents would watch the movie at the same time. So that's what we're looking at doing instead. We're hopeful that we can get this all organized by the end of February, try and screen it in February. But you know, meetings, room space here sometimes is challenging, especially in the evenings. So we're going to see what we can do and go from there. But we're hopeful for February in the evening. So we'll see. More info coming at our next meeting, hopefully. Okay, I'm going to stop there and open it up to other sectors. If anybody has anything that they want to share from their sector before we move on to our Kelly's presentation and our infographic review. Does anybody from any sectors have anything that they want to share? Christine, do you want anything that we didn't include? You want to kick us off?
Yeah, so as you can see, Project Community Pride is partnering a lot with Madison Chatham Coalition, which is wonderful. We're really bridging the substance-free with mental health, so I think that's great. We ourselves are also going out to the schools and doing some lunch groups. We have Vicki here, she's going to be running some groups in the middle school, as well as she's doing the second grade group, which is wonderful as well. But that's actually started in Forum Park. And we are continuing, obviously, with our individual counseling. We are continuing going into the schools, doing with MCC as well, but the mental health tabling as well. So we're busy. Good things.
Any other sectors want to share any updates? You guys have anything?
I don't really have anything to update.
Yeah, so as I mentioned, the health department now is providing services to Madison Borough. And so I just got appointed as the new coordinator for the Municipal Alliance in Madison. So I'm probably going to be busy just, making connections with Madison folks now. But other than that, for Chatham, I have started implementing footprints at St. Patrick's School for the second graders there. I'm in my third week, and we're probably going to be doing sticker shock very soon with the Super Bowl coming up with the students, and we're looking to collaborate either with Sad Tattoo or the Mental Health Club at Chatham High School to have a Random Acts of Kindness table. Random Act of Kindness month is February, and so we're trying to do something with them around that topic. But the kids are getting trained by LMTI the next 2 meetings, so February and March. We're having them come down and do some training with the students. So we'll see as well.
Thank you. Diana, did you have anything from schools that you wanted, from Madison schools you want to share?
Yeah, I could give an update besides, I know you mentioned our tables, which, quickly just want to like touch upon those. Thank you guys so much. I feel like, our goal with those monthly tables is to bring MCC and PCP into the school and get the kids familiar with it. And I think they have a lot of fun. Like Allison mentioned yesterday, we had one with anxiety. But it's definitely meaningful too because the kids are getting those information sheets and fact sheets. And there was a lot on there about, sour candy and how it could help with panic attacks. And it talked about like the amygdala and all that. So I love all the ideas that they bring to the table. Coming up on February 9th, we have the Game of Life that's hosted by Deirdre's House. So I think we have 30 providers coming, but they organize the whole event for us. So basically, myself and the rep from there, David, we're just kind of going back and forth on like logistics and preparation. But it's this big resource fair where the students are given a problem scenario. And there's a bunch of different problem scenarios, and they go to each provider and try to see which ones would help them solve that problem. There's also a little like passport book that they get when they could check off and visit different tables. So he still has to send me that so I could see again the providers and what that is going to look like. But it's going to be an all-day event. The kids are going to come from the gym and health classes, and we're going to target the whole school. So that'll be coming up on February 9th. And then we have Paul Lavella from New Jersey Recovery and Wellness coming in on March 11th. It's one of our PD days. He's going to come and present. But we've worked with them a lot with like referrals. They do testing, and NJ Raw is really great where all the clinicians there are, addiction specialists. They have dual licenses. They do dual addictions, and besides substances, they have like counselors that focus on like gaming addiction, shopping addiction, social media addiction, any of that stuff. So he's going to come and present to our staff on the March 11th. So, and I think that's it.
Great, thank you. Anybody else? Good. Okay. Before we go into Kelly's presentation, kind of something that she's going to be talking about is we did this at our January meeting last year when Kelly gave her presentation, but we have our year in review, which is it's optimized for screens, not really we printed out. But I just wanted to go over a couple of quick highlights, which Kelly has some in her, yeah, if you wouldn't mind, thank you. Kelly has some of this in her presentation when she looks at, evaluating the coalition for the year. But a couple of things I wanted to draw attention to. So our social media impressions, thanks to Elise, who has done such a great job with our social media. We, again, this year saw a 29% increase in our followers on Instagram and a 10% increase on Facebook. So really that's how we're getting so much of our information out is via Instagram. What's great about Instagram, we've talked about this before, is the analytics that we can run on everything that we post. We know who's looking at it. We know when they're looking at it. We know what kind of content is most readily consumed. So we're able to kind of tailor what we are posting to ensure that we have the widest reach. So we're going to continue to expand on that this year, specifically next week when Gabe works on launching our Myth versus Facts campaign. That's really, we've learned that's the most effective method of communication for us with our with residents, with our followers. We had the volunteer hours, so that's the number of hours that volunteers spend attending meetings, participating in events, tablings, our leadership team, things like that. We had an increase, a 646-hour increase from last year to this year. So that's a huge number. As a coalition that has a match requirement each year, we quantify those hours, and that's a big number for us. And that really speaks to our efforts towards sustainability. We want to see that number increase each year so that at the end of our funding, we can show that we will have this support. People are obviously not being paid to volunteer for. That's the point of volunteering, I suppose. So we like to see that number increase each year. So that was a highlight for sure. Elise did a lot of, she pulled a lot of data on number of reels, minutes of reels that were viewed on Instagram. So I like that 1,525 minutes of reels viewed number. Those take so much time to create, and like sometimes it feels like you don't get much bang for your buck. But when you see that's the total of number minutes that people actually spent watching the content that we're creating, that's satisfying to see that number for sure. The Narcan opioid reversal kits, that was a new one for us this year, for last year, I should say. We were able to distribute 40 kits. And that was through our relationship with Hope One of Morris County. So they spoke here at a coalition meeting. We were able to distribute them at that meeting, but then also we had Hope One van here at the Madison Area YMCA for the first time ever. So they set up a table in the lobby in January, and we were able to distribute even more kits there. So we were proud of that number of those kits that were distributed. Our original materials, so we're keeping on that, we're keeping to produce as much as we can, not looking to other vendors for materials. So they're great, human relations and all these other companies that produce, educational materials related to substance use in teens. But we started a couple years ago creating our own stuff in-house, and we want to continue to expand on that so that, when it comes time, we don't have to pay for, we don't have to do this stuff out of, somewhere, give money somewhere else to vendors. We can continue to just make these materials. It also gives us power over what we are creating. If we go to an event like Hidden in Plain Sight and we're hearing a lot of questions about fentanyl, or we're hearing a lot of questions about prescription, we had a lot of questions about Adderall this year as well. So maybe that means that we need to produce an Adderall rack card. That's not necessarily our focus, but if that's what parents are interested in and that's what they need materials on, then that's what we can produce. So we had 19 information tables this year, which, Christina, I would say it feels like it was more than that, right? But looking back at the numbers, it was 19 information tables. So those include events like Fish Whack, Bottle Hill Day, tablings here at the Y. I mentioned the Hope One table. We had a table with a nutritionist in December where kids were encouraged to stop by, learn about different aspects of nutrition. So all of those tables, we look to expand that number each year. 2 years ago, we had 17 tables. This year, we had 19. Maybe 20 is a good number for this year. We don't want to get too ambitious with that. But yeah, that's just like a high-level overview. If we look to the other side, this kind of has our highlights for the year, things that we consider to be our highlights. So first, Take Back the Vape event at Madison High School, which we worked with law enforcement on that event and Madison High School. Our November Bagels and Brainstorming event where we had 20 police officers here. Basketball at the Y, launching that initiative. Draw the Line, which was our alcohol prevention campaign. And then our Red Ribbon Week art contest where we had 20 entries. That was a win for us this year compared to the 4 entries that we had last year. So, I've said this before, but what seems like a challenge sometimes, or sort of an annoyance of having to report everything, the plus side is that we're able to produce these metrics each year, and they're able to show us how we are progressing as a coalition and the progress that we've made year over year. So it's nice at the end of the year to be able to go back into Reach and pull all this data and to be able to share with members what that all looks like. So Yeah, that's what I have. These are, please feel free to take these home. And if anyone has anything that stands out to them, any suggestions where areas that we can improve, which I know Kelly is going to touch on in her presentation, please do let me know. So with that, I'm going to turn it over to Kelly for the presentation.
All right, thanks, Allison.
Yeah.
And I will say that infographic stands out, among so many others that I see. Like, I'm always in awe of what they're able to pull together. For someone who's not a professional like graphic designer, this is not her job, but to be able to do this every year is great. So I was here last year, going to do kind of a similar thing. It feels weird to stand up, given this.
You can set up. You can set up.
So I go on my back to Kathy the whole time. But we're just going to go over sort of the highlight from this past year relative sort of the evaluation process. Last year, we spent some time talking about your recent student survey data, as well as some community survey data. And as Allison said, this year is kind of a data collection year. And so we're going to hopefully be doing some new student survey data, some qualitative data collection. And so we're not including that this year because you've already seen that. Don't want to spend our time on that. And then we'll get to talking about logic models. So when we think about evaluation, we look at it, I don't know why it's cutting off at the top. Oh, well, it's fine here. So, but when we evaluate, we do it for multiple reasons, right? So we're doing it for, we want to be able to show our impact, like, how we've changed our community. We're seeing fewer kids drink. We're seeing, parents increasing their disapproval for marijuana use. So those are obviously things we evaluate for. But we also evaluate so that we can improve our efforts, so that we know what's working, what's not working, and what changes we need to make. If you're spending all of your time doing a certain project and we're not seeing any changes as a result of it, like, do we just stop doing that project, or do we make changes to that project? So how do we adjust? We evaluate so that we coordinate our work. We make sure that, if we're working really hard in this area and Madison PD is working really hard, like, hey, I bet if we worked really hard together, not that you aren't, that was just an example. I know you guys work together all the time, but are we collaborating and coordinating with the people we need to? We evaluate so that we can hold ourselves and each other accountable. Again, it gets back to have we seen the changes that we've wanted to see? And if we haven't, what's been the holdup? Sometimes there are outside influences like, legalizing cannabis, right? So that might impact things, but it's making sure we're holding ourselves accountable, not just for our outcomes, but completing the work that we've said we want to complete. And Allison does a great job of tracking, even though I know she hates it. And putting all the information into Reach. She does a really good job.
Elise, that's not.
Well, Elise, we're just going to say Allison does a great job with that. And so you're able to look at, here's our action plan. Here are the things we said we want to do. We're tracking our work, and it's an accountability space. We evaluate so we can celebrate. We know what's working. We know the things that we've been great at. We know the changes that we're making. So let's celebrate them. You guys have a lot to celebrate based on what I'm going to cover here and then that infographic. So, come on, everybody. Do you do some sort of celebration throughout the year? It's important to recognize the great things that are going on, not just to the people in this room, but toot your own horn outside as well. And then we evaluate for sustainability purposes. We figure out what's working, and you may lose, a reduction in funding. And so is there somebody else that can take on the successful project that, we may no longer be able to fund, but can somebody else take that on because we can demonstrate how successful it's been? We can show our value. We can show our value to new funders, possibly. Like, here are the things we've done. We're great. You should give us money, right? If somebody comes to them and says, hey, just give us money, and Allison comes and says, hey, give us money, we're awesome, we've done all these things, who are they going to be more likely to give money to? The group who can't prove their worth, or the group who's kicking butt? So those are some reasons for evaluation. And I'm just going to briefly go over your annual evaluation report. Allison has the full version. I don't know if you've shared it with everybody yet. Okay, and then there's an infographic that is not nearly as great as her infographic, so you can certainly ignore that. But the report is, 20 pages. If anybody wants to look at it,
I will share it out.
yeah, feel free, and feel free to ask me any questions. But I completely understand that that's a lot for people who are not interested in data.
I'm sure it's great reading.
Yeah, if you need to take a nap, whatever, you won't hurt my feelings. But so this covers October 1, 2022 through September 30th, 2023. We do it based on your grant year, just because that's a reporting cycle they have to do. So during that year, your coalition reported 593 different outputs. So different pieces of work over the course of a year. That's a lot of work that's being done by the coalition. Of those, 30 were community actions, and community actions are the steps that you have to take to create changes in your community. So changes in policies, new practices, new programs, partnerships. Those things don't just happen, right? Allison can't just say, okay, Madison PD, I want you to do this for me, and then you just do it, right? You might always, but
they are pretty.
but sometimes if they're like, we want you to change your arresting process, you're not going to say, sure, whatever you want. There are things that have to be done in order to create these changes. So we want to track those in case our intended change doesn't happen. I worked with a coalition in Massachusetts years ago, and they were heavily fighting against recreational cannabis in their state. That's all they did for a year, Even though it was polling it passing at like 77%, they went all in on this, and they didn't track their community actions. So what did it look like? Like they hadn't done any work for the past year. And so it's important to make sure that you're keeping a record of the things that you're doing, and maybe what you're trying to change doesn't happen right now, but you've created all this momentum and education so that in 2 years, someone might say, oh, remember when we talked about that? This is the moment, this is the time where we can get that done. But you were able to report 16 community changes, which is a significant number over the course of a year. 223 media outputs with, almost, or a little over 250,000 media impressions. And how many people live in your area?
Like 35 total.
Yeah, so, you're hitting a lot of people over and over again. And then people who live in your adjacent communities that, as you said, may attend schools in Madison. And it sounds like Elise was involved in some of that social media stuff. 284 data entries for resources generated. And as Allison mentioned, you guys, as part of one of your grants, have to demonstrate a match every year in order to keep your funding. And that includes in-kind, volunteer. So your support of the coalition is really important to meeting that match, because if you don't meet it, then you don't get your grant funds. So it's really important to have community buy-in.
I just want to also say, we've had for the first 6 years of this grant, our match has been 125%, which is a 100% match. This year, it jumps to 156. 250, something like that. Yeah. It's a 25% increase for year 7 and 8, and then it's, what is it for
150?
150% for 9 and 10. So we want to continue to show that progress.
Mm-hmm. And then you reported 40 services for 305 hours of service to 2,318. And Allison, has gone over a lot of those, but anything she's really talked about today, aside from that infograph, is what's happened, since October. These are not things that are included in this report. And, I feel like you look at it and the hours of service seem quite low, but you're talking about these tabling events where you're able to capture somebody for 5 minutes and talk to them. So you're still hitting all 2,300 of those people. Any questions so far? Interrupt at any time. Questions? Kelly, you're not talking very loudly, whatever feedback you need to give.
I just want to say you can click the top right X and that way you can see the top of your screen if you're missing something wrong there.
Well,
I think that's the teams.
I don't have access to that because I am presenting as a meeting attendee.
I think that's the teams thing anyway. It's teams, it's not that.
Sorry.
We can see it.
Well, at the top, it says coalition efforts 2022, 2023, 593 outputs.
Oh.
There's just a chart showing that. And of those 593 outputs, 533 of those were sort of this broad general alcohol, tobacco, other drug focus. And kind of leading to the conversation we're going to have a little bit later, because you are doing a lot of mental health work, because there is that overlap between mental health and substance misuse. It looks like this general ATOD space is much higher than it actually is, because we're going to be talking about creating a specific mental health logic model.
The other thing I want to mention to this too is when I'm doing the reach entry, if we have a table and we are we're focusing on both marijuana and alcohol at that table, it's captured as general ATOD unless I do a second entry for the other substance. So we kind of learned this we didn't learn it, we knew it, but we focused a little bit more on that. We learned it middle of last year. So I feel like this year there should be a more distinct. So I feel like that 533 might be a little bit elevated, and the 41 and 19 might be underreporting certain things because we're not doing double entries. But we should be doing the double entries which we have started doing moving forward.
Well, and this is like the purpose of this type of report is, okay, these are an area where we can improve.
Yeah.
Right. So you're taking the findings of these evaluation reports seriously and adjusting your work, which I love to see as an evaluator.
I might have missed it, but what is ATOD?
Alcohol, tobacco, and other drugs. Sort of a broad, it may not be a specific area that you guys have said you want to target, but then the Hope One opportunity comes up, and what are you going to do? Say no?
Yeah. So that's a good example of it. Yeah. Hope One would be reported as general ATOD. The partnership with the library, where we focused on May Mental Health Awareness Month, and that's a good example of something that had multiple entries. That was a community action, then it was a community change because it was a first partnership. And then it was a service provided because we had materials there, but the only way that it can be captured is as general ATOD, which is why we're going to talk about the thing that we talk about in a few minutes.
So around general ATOD, 90% of your efforts were there. 94,355 media outputs. Most of your resources came from general ATOD as well. 131, almost 1,600 people were served in this area. And, the outputs or the activities here, the teen task force meetings that were held, some of that resources generated in planning, and the vape take back event, which I think is a big success. And I work with 35 coalitions all over the country, and you guys are one of like 3 that are doing that.
We didn't get any vapes, but that doesn't.
There was a lot of materials.
That we had out.
But you're still putting it out there.
Exactly,
That's what it's about, is getting that.
Oh, for sure. And we gave out hundreds of cards of amphetamine.
Yeah.
And candy, yes.
But it also now lets kids know that there's a way to dispose of a vape without them, getting suspended from school for a week, or, there are ways that they can be supported in cessation and all of those other factors, that just because a kid doesn't turn in a vape doesn't mean it wasn't successful. The Hope One partnership, social media volunteer time, the teen mental health first aid, teen talks, and then the wellness fair and prescription drug take back events that you're supporting your partners with. So these are all good things that are happening. I'm not trying to say they aren't good just because they're ATOD. They're all great things. It's just you guys have said you want to structure your work around 2 specific substances and now mental health. And so that's why they fall here. Yeah, I hope you don't feel like I'm dogging the work that you're doing. Okay.
No.
Good. So around alcohol, that was about 7% of your work. 630 media impressions. You served 13 people, which I think is probably low.
Oh, yeah.
And again, this is a great opportunity to take a look at it and say, oh, we forgot about like X, Y, and Z because you're so busy. And so some of the work there was the senior prom prevention with Madison High School. It's a great translating the sticker shock campaign materials to Spanish to reach, a different sector of the community. It's a great way to enhance access to folks being able to understand the regulations around purchasing alcohol or providing alcohol to minors. You had the 7th grade initiative and then the Draw the Line campaign, which I haven't worked with anyone that's done that before. So it's very innovative. And we've talked a little bit about kind of once it's fully going, how we might try to evaluate that. And is it, hey, law enforcement, have you been anywhere where you saw a line on a bottle? Like, what sort of things are you seeing? So that's a conversation we're going to have later. And then social media, sticker shock, and compliance checks. Are any of these activities new to you guys and you need me to explain what they are or Allison to explain what they are? Okay.
This is, I said this at especially when we focused on Draw the Line.
Yeah.
So many of our efforts this year, I think more so this year than in the past, have really been coalition efforts from start to finish. So I think there's been that ownership, particularly this year over these projects, which is great. That's, that's really good.
I just want to make sure no one's leaving. Like, what is this?
Yeah.
And then marijuana was 3% of your work. And, I think this was also an area that was underreported. Perhaps that you think about vape as nicotine, but as law enforcement agents, how much, what would you say you're seeing in vapes? Is it a lot of THC now?
It's mixed.
Yeah. But that's a spot where vaping is not just nicotine at this point for people in your community.
That's been the biggest thing for however many years.
Yeah.
Yeah.
I was talking to my brother-in-law and he's like, wait, kids don't roll joints anymore?
Oh,
Some do.
Some do. And I was like, no, a lot of kids vape. And he's like, that's unacceptable. They should learn how to roll a joint first. And I was like, well, I guess that would make it more, I don't know. But part of your marijuana efforts were around the Basketball with the Y, which I think is a great partnership that you guys have to do that, to provide a space for kids to come to on a Friday night. When their other alternatives may not be as safe or healthy. The dangers of vaping workshop. So you did include that THC component for this specific one. The vaping cessation cards, again, that targeted marijuana piece. You're providing resources at the back to school nights, and then to the Mariners swim team around vaping and THC as well. So those are the big highlights of your work around these specific substance areas. Are there other things that you guys are aware of that I did not share that you wanted to throw out? Because again, there are 593 outputs and I have 25 minutes to talk to you. So
That's pretty comprehensive. That's good, comprehensive. Yeah, we included.
So when we talk about coalition work, there's some research that shows that there are 7 different types of strategies for community change, for comprehensive community change. And so as Allison reports, she reports on the work by the type of strategy. And so we have individual strategies, providing information, providing support, and enhancing skills that are intended to target individuals. So you can come into a room like Hidden in Plain Sight, you're able to educate the 49-ish people, which is a big turnout, by the way, for a weeknight event. getting people to leave their house
In the winter.
and you guys had terrible weather last week.
Very cold, yeah.
And so those individual strategies are going to hit people. You're going to talk to them. You're going to engage with them. And then we have environmental strategies, which are strategies that are intended to hit everyone in your community, whether you talk to someone or engage with them or not. And so those are changing policy, enhancing access, reducing barriers, changing consequences, and physical design changes. And, you know, some of the ones you've already mentioned, compliance checks are changing consequences, right? So law enforcement goes in, checks to see if folks are selling underage or illegally, depending on, you know, if you're doing it on premise, maybe you're checking for over service, those different types of things. But even though you're only talking to the clerk, it's impacting that clerk's behavior for everyone in your community. One would hope. If you change a policy, it's going to impact everybody who lives in Madison or Chatham. Same thing with access barriers. You know, by hosting take-back events, you're making it easier for people to get rid of their pills. You know, if there was an event or a spot at a law enforcement station, would you know how to get rid of medication just as a regular person? No, right. And so you've increased access to these things. And so 5% of your work was environmental this past year, which was an increase from last year. We hope to see that increase again this next year. And I know that some of your work sort of planned around that. So that's good to see. And I think, again, perhaps there might have been some underreporting around marijuana environmental strategies, because you guys were part of those conversations about how to properly address, I'm trying to figure out how to word this, the location, a possible dispensary in your community, right? Not that you were necessarily taking like a policy position, but here are best practices. Here are the, in our opinion, here are the things that make sense.
The environmental strategy versus individual strategy is, I feel like it's hard for a couple different reasons, but it seems like individual strategies cost money and environmental strategies don't cost as much money. And so, you know, the things that we spend money on, like materials, or I don't think we've ever paid for a speaker, but, you know, that's another thing. You know, the environmental strategies, like changing policy somewhere, whether it's here at the Y or in the community, those take a lot of meetings. It takes a lot of time. It doesn't take money, right? So I feel like that's always been a little bit of a challenge for us.
Yeah.
Kelly doesn't have the breakdown here, but when we report this to the DFC, when we do our federal report each year, we have to number which strategy we spend the most time in. And when I was looking at that this year, for last year, it seemed, you know, providing information was always our number one. Like, you know, giving out materials through project graduation bags or at a table event, whatever. This year, we definitely switched that to providing support. Providing support was by far our number one strategy that we employed. And I think, you know, you look at things like basketball at the Y, you look at things like our vaping workshops, our teen topics, you know, that's going to translate more to the people that need these services. So that was something that stood out, like when I was doing the reporting this year. So we're getting there.
Yeah.
You know, to not have providing information as number one, I think is a good thing, but it's just going to be happening. Always, we're always going to be providing information.
Yeah, absolutely. And I think you are right that while it costs money, it's much easier to like, here's a flyer.
Yeah.
You know, versus, hey, I would like for you to change your entire, you know, infrastructure.
Yeah.
So it's increasing, and I think, you know, hope to see that increase again in the years coming. So this is a 5-year view of your work just by priority area. And, you know, some people hate this type of chart, some people love it. If you don't like it, I can give you a different one. So just depends on how your brain works. But across all the past 5 years, general A2D has been the sort of the first area that you focused on. And you can see that the second area of focus, 19, 20, 21 kind of fluctuated. And then the past 2 years, alcohol has been your secondary area of focus, followed by marijuana use. So, hopefully maybe next year we're going to, one of your substances may not be the first area of focus, but we're going to see that increase. So it's A2D is no longer that 90%. Keeping an eye on the clock. So successes, we've actually already talked about these. Allison talked about them as part of her wonderful infographic. But I really do, some of the things you're doing are unique and are different from other communities. So I think you're out ahead of a lot of what other people are doing. So you should really congratulate yourselves on that. And I know that it's been a lot more work in this room as a group. So great stuff that's happening. And the engagement of the Spanish speaking community, and Gabe's going to be jumping on that even more, is good to see. And then some recommendations. We've already talked about the first couple. Making sure that we're working on those community changes to try to, establish new policies, practices, partnerships. And you guys are constantly bringing on new partners, or you're working with your partners in a different way. You're not just, oh, well, we've always done this, so we're just going to keep doing this with the school and we're never going to do anything different. You're constantly doing new things and improving the things you're already doing. Making sure that you're continuing to develop and nurture those partnerships. So yeah, most of the recommendations, one is to make sure that people are getting the training that they need, and there are a ton of online, trainings that you can participate in for, an hour or whatever. So if people are interested, make sure that hey, Allison, I really want to learn more about fentanyl, and she can probably in 5 minutes find a webinar that's coming up about that topic. And then review and update logic models as needed. And so, as I said earlier, we're hoping to get some new student survey data. So we'll be updating your marijuana and alcohol logic models, and then chatting about a mental health logic model right now. So do you want me to just go over these couple slides, or do you want to go ahead and talk about that?
I'll just briefly talk about the current state of our logic models, and maybe that then we could just kind of spend our last few minutes on mental health. So we've talked about our logic models before. We have one for marijuana, we have one for alcohol. Sorry, my voice is. So we create these logic models. We make changes to them each year. We start with a problem statement. Then we go into our root causes, which is why is it happening? So the problem statement is what's happened, what's the problem here, right? So youth are using marijuana or youth are using alcohol. The root cause is how, right? Why, it's the why.
Yeah.
So for our alcohol logic model, it's access and favorable attitudes. Those are kind of our two. And then our local conditions is like a why here. What is specifically happening here that's driving that youth substance use? So we take the data, we take our quantitative data, we take our qualitative data, we try and have 3 data points for each of our local conditions. And, we collect this data from student surveys. And then also qualitatively, we're collecting it by our student surveys for quantitative data, and then also our community survey, like we did at Hidden in Plain Sight the other week. And then when we're doing our qualitative data collection, we're doing our key informant interviews with law enforcement. We're doing listening sessions with youth. We're doing listening sessions with parents. And so we're taking that data, and that's really kind of telling the story, more detail about the why here, so those local conditions. So our logic models for marijuana and alcohol haven't changed too much over the past couple of years. I think there was a big change in 21, 22, and not much has changed. We do notice that there are gaps in our marijuana logic model. things, a lot of things have changed since 2021, when the state legalized. So we're still trying to perfect the marijuana logic model, but in conversations that Kelly and I have had, like when I had to go through the Coalition Academy and get these products approved, it was very specific the way that you needed to do it, and those 3 data points that you had to have. We don't have to do that anymore. But what's so important about our logic models, obviously line logic, right? So we can read it straight across. The other piece of this that you don't see on this actual logic model is our 12-month action plan. So the action plan kind of sits here, and everything that we learn from our logic model drives all of the actions that we take as a coalition. So we create our action plan each year. It has to be new each year, and then that's what gets approved by the CDC. And with marijuana in particular, so many rules have changed, with what law enforcement can do, and that then has an impact on Project Community Pride and the referrals, and then MCC, how we can provide that education to kids. And then that also is affecting the data, like how are we, what are the numbers looking like for referrals? How many kids actually are using in Madison or getting caught, in Madison and Chatham and getting caught and then referred? These numbers are everything's still 2 years later in a state of flux with that. So that's been difficult. I think what we're looking to really pinpoint when we start doing this qualitative data collection in the next couple of months, when we start doing these interviews again, is trying to get some more information where we can. I'm really looking to student assistance counselors. When Gabe starts to do some listening sessions with youth, we want to hear from them, get some more specific information, which we really hope will be able to bulk up our marijuana logic model. We'll also take the student survey data that we collect in the next few months in Madison. We'll combine that with our Chatham data from last year, and that'll give us a better indication of kind of where our core measures are. So our past use, all our quantitative data. So our past use, our parent perception of risk and harm, and perception of peer disapproval. So we'll be able to input those numbers and kind of see where we stand and see. At this point, we should be able to start noting some trends, right? We'll have enough data. But that's all to say that we want to do the same for mental health. We, as Kelly talked about in her presentation, and when we look at, the big number, general ATOD, so much of that is mental health, and we're not really able to capture it in a more meaningful way, I guess. So what our goal is to create a logic model that focuses on mental health, so that, when we are doing all of these activities with Project Community Pride or other partners in the community, and we do focus on mental health, we have a plan to look back on and say, well, here's why, here's our data, here's how mental health is driving underage substance use, because we do know that there is that link. So that's kind of what we just want to spend the last couple minutes on today. And then that is going to be our work as a coalition for the next couple of months to really solidify that and have something so that we can get a clearer picture of what we're working on.
Yeah. So Allison kind of already talked about
Sorry.
things. I appreciate it. But she nailed it. It sets priorities, you align your outcomes. It also helps you engage in stakeholders. Like, here's our plan. You sit here. Here's what we can do for you. Here's what we'd love for you guys to be a part of. And you may have, some of you older members may have seen the logic models, because you post them beside your bed and wake up and look at them every morning. But this is kind of the structure that we have always followed with but why? Why do we care about mental health? And I think that's the first question, as a group, you guys need to have, what do you think? Why should a coalition care about mental health?
It's affecting so much of our youth
right
today.
Mm-hmm.
and it affects substance use, right? And there's a correlation.
Right.
Yeah, definitely the strong correlation between anxiety, depression, and using substance use. And also education, lack of education to help with both of those things. So.
Okay.
I was just gonna add to time. I think that what Christine and I have learned is that like we have such a rare opportunity to engage with parents. And if we only have one shot, let's hit them with both things that are affecting so many parents. Let's give them as much education as we can, as much information we can, I should say, about mental health. And then also here's some information about substance use. So, yeah.
So what do you, because mental health is, you know, enormous, right? So there's so many different pieces of it. And it sounds like, you know, you guys are wanting to just, you know, let's make sure parents are aware, let's make sure kids are aware, and some strategies, right? As a partnership. I know Project Community Pride does direct service.
Yes, we do.
That's not what the coalition's trying to jump into.
No.
But what are the gaps, such as lack of education or information, that you think fit what the coalition could be working on?
I don't know if it's a gap, but it's a factor, and that's the willingness to talk about mental health.
Okay.
You know, historically, it's been too sensitive and nobody has that problem. And I think since the pandemic, people are more willing to say, you know what, I'm messed up and I need some help.
Yeah.
So I think there's less of a stigma, but it's still really sensitive.
Okay. There's the stigma, there's a lack of information that you guys are seeing. What about other folks? Are there things that, you know, they're like, ooh, this is an area where the coalition could provide support? I mean, those are two very good ones.
I don't know that the coalition could provide, but there's a lack of education. There's also a lack of resources for mental health. And Christine knows that, and Vicki, as much as anybody in this room. And I don't think that the coalition can do anything about that directly, but collectively we could influence the conversation.
Access, though.
I have a question.
Go ahead, Rosella.
Okay. All right. So we have information from our local police departments on any kind of interactions they have with young people getting involved in. And do we have any kind of information from medical facilities about whether or not there are more young people who are getting medical attention because of substance abuse?
I feel like it would be really hard to separate from in a town perspective.
Yeah, but I don't know if there's reporting on that.
Yeah, and I think,
It's not like.
It's different with HIPAA.
It's
the
HIPAA, yeah.
it's a
Because-
HIPAA issue, I think.
Yeah.
Because when we talk about mental health, I mean, we're talking about a cloud. You know, unless we have some kind of measuring points to know, you know, what families are seeking, assistance for kids. I mean, we know when people interact with the law because those reports can be easily generated, and we have input from our 3 different police departments. I'm just wondering, when we talk about mental health, are we talking about something we actually have data about, or are we just talking about our general impressions?
I think that the data for, when we look at the data that's going to support this logic model, so much of it is going to be qualitative. And it's, like we've tried to, even trying to collect data from local EMS about substance use issues, it's difficult to collect that data. So I can only imagine that it would be even more difficult to collect data related to mental health. But that doesn't mean that we can't collect it in a different way. Yeah. So these listening sessions, these key informant interviews, that's where we'll learn so much more about what's going on. And also our community surveys, and also our school surveys. Schools typically do add those mental health questions, but we have not added questions for parents about mental health. We didn't want to add it to this survey for hidden in plain sight, but that will be another quantitative collection point that we can look at to start getting some of that data.
Yeah, definitely something we could add to the broader community survey, not the necessarily event specific.
It's really hard to pinpoint community mental health.
Yeah.
Because I think we talked about stigma plenty no one wants to talk about it, even today,
Right.
unfortunately. It's hard to talk about, and it's such private information. So even for EMS, like they may, respond to a home where there's suspected alcohol intoxication, but they will not know if that person has a mental health, condition as well. It's just impossible to know.
Yeah, and they may only be tracking by the like primary service. So if somebody falls
Right.
down and breaks an ankle,
Exactly.
that's the primary reason they're getting served, but they were drunk. And
Right.
that's why they broke their ankle.
We also can look at what's happening, like in Madison, that mental health clinicians are accompanying officers on calls. So we can, and that's fairly new. So we can, we can use those things that are happening as well to sort of guide our actions as well.
Yeah. Absolutely.
So can I just add, I know that the high school, at least last year, in speaking with the administration, they said they added like 2 mental health type clubs. And I don't know if you guys are able to go in there and actually coordinate with
That's
them as
cool.
well.
Yeah.
But the fact that the kids are coming to them to start new, they had one.
Yeah.
And I think there's 2 different, I don't know
Yeah.
what the varying
Yeah.
types are. But the fact that the kids are engaging and wanting these things, I mean, that shows, I think to me, that age group is starting to see, one, an awareness, 2, there's less of a stigma.
Yeah.
And I mean, especially with coming out of COVID, a lot of it I know was anxiety related, but the parents, and talking with parents now, I feel like as a parent, we are more open to recognizing the pressures and what's happened since the pandemic, and being more open to that conversation. And not sticking our heads in the sand, so to speak. Because overall, it's about the quality of life. And if you can't get that at a young age, it's going to be very difficult as you go forward into adulthood.
Yeah.
It's refreshing to hear such open-mindedness. I think that still for us as clinicians, it's not the majority of what we hear.
Okay.
But
getting the access, like things that you're talking about, like finding like access and the resources for it.
Yeah.
It's very hard. And then
it is very hard.
and the cost involved in that. And then the quality of care, like what do you get with that?
Something I know that, PCP we're really proud of is, we can't service everyone, unfortunately. And something that we're doing a lot, and I really enjoy doing, is case consultations. And that's being able to speak to a family who needs services and referring them to places that fit their needs to the best of our ability, giving them resources that they wouldn't otherwise have, or have the ability to make connections to.
Right.
And that, I think, is a really enjoyable part of what we're doing. We're allowing ourselves to help, even if we can't work with that family.
Yeah. I didn't even know that was an option.
I don't know if the chief is still on.
I don't think so. I think he just hopped off.
He's off.
Yeah.
I was gonna add, maybe he could, I don't have a lot of information myself. I don't want to say the wrong thing, but we are a part of the pilot program called Arrive. And you kind of just mentioned it.
Yeah.
So we will be having, a mental health professional available to us. I don't know if it's 24/7. I'm really sure how the scheduling is going to be, but for these cases that we go on, if it's an emotionally disturbed person or whatever the case is, that they're there. That's going to be, we're our first line of defense, but then they can hop right in. It's immediate, so that should help moving forward too with a lot of these situations, no matter what age the individual is.
Yeah.
I think also similar to what, your point that you just made, kids have these clubs now, like Morgan's Message, athletes have that, and at CHS there's Mending Minds, and there's Morgan's Message at Chatham High School as well. So these kids are supporting each other. They're talking about it openly. They're coming to tables and they're taking these materials about stress and anxiety and depression. And parents are supportive, but they're not getting the same education that kids are. And so this is what we deal with as a coalition that focuses on substance use prevention with kids. They're in health class, they're getting dangers of vaping, learning about fentanyl, one pill can kill. They're learning all these things in school. Parents aren't getting the same education, the same information, unless somebody is providing it to them. So I feel like a thing for us this year and last year has been, okay, how do we bridge the gap? There's this information gap it's very broad. So how are we bringing parents up to the same level that kids are, so that parents know when it comes to mental health, here's how I can support my child, or, here's what I need to look for, so that a kid is, a teen isn't just like outwardly showing these signs and looking for this support, and parents are just missing that. So I think that we can sort of use that same structure for how we address mental health as well, and how we, you look at our logic model, access, favorable attitudes, a lot of this does translate to mental health. It's just a matter of collecting the data to really help us support that.
Yeah.
So do you have like next steps for us?
So I think the next, well, this is how you solve the mental health crisis in America. Laughing. How many billions of dollars do we have? I think the next step, and we've already heard some of these, lack of education, stigma, some of these things that really are the starting points for the logic model of your root causes for creating this general awareness of the issue, because you guys are not clinicians, maybe. Yeah. The coalition itself is not you are not a direct service provider for mental health services. I think, Diane, you mentioned access to services, but that's not necessarily like the coalition's role, but maybe you guys could have some influence, hey, let's call and, say how much this is important, how we can support this. And, hey, Madison PD is doing this amazing partnership, throwing news that way so that, if someone's like, oh, maybe this isn't worth it, but, folks, the powers that be are hearing from the community and, oh, this is a worthwhile investment of their resources. But I do think the next step is to sort of, maybe it's as a whole group or a couple people are interested in doing it, but pulling together some of these, local conditions of why here in Madison Chatham communities are these, is there a stigma? Why might there be a lack of access to information? Whatever you decide, because you guys are a very different community compared to other places. So you have to make sure that your local conditions are specific. Because, in some places, if you're going into Newark, you're going to have very different local conditions than you're going to have out here. So making sure that you're specific to your needs. And then, as you talk about things, I can come to a meeting, or Allison and I will be in communication about, hey, we feel like we need more data on this. And that's a conversation of, okay, well, is it already out there, or do we need to figure out a way on how we're going to collect it?
So, yeah, and I think moving forward, our next meeting, we will have more of a concrete conversation about what those root causes look like. But like Kelly said, she'll be able to help with, we know we want to collect this data. How do we phrase it so that we're collecting it, in a way that is appropriate and is going to tell as much of the story as it can. So that's definitely going to be our focus moving forward. I appreciate, Kelly, you coming and, you giving us this presentation and kind of giving us an overview of where we stand. And I thank everybody for coming and participating as always, and for listening and staying for 3 minutes past our meeting time end time. So thank you all. Our next meeting is on February 13th here in the Hubbard Room with a virtual option as well. The meeting recording will be available on Friday in our newsletter. That's all. That's all I have.
I would like to say thank you for listening to me, but then also for doing really innovative work that I can then take to other people.
And I think we can thank Kelly for reminding us to celebrate the great work that this coalition does and under Allison's leadership. So there's a lot to celebrate. So thank you for reminding us about that. Yeah.
Thanks, Kelly.
I'll bring a cookie cake next time.
I'm going to hold you to that.
All right. Thank you, everyone.
Thank you.
Yes.
He was still up.
Document came back before that. He wasn't only 5.
That's what I said. He took a bathroom.
He would have done a better input. He was a part of getting the pilot program.
Yeah, so really successful pilot program in New York City, actually.
We have one where I live, where it's